Welcome, everyone. Oh, is this on? Do I have to turn it on? Do I need it? Everyone can hear me? It might. It's on. Okay, perfect. All right. Welcome, everyone. Thank you for joining us today for our Care for All event. My name is Angela Vasquez, and I am the Policy Director over mental health at the Children's Partnership. I will be your MC today, and we've got a packed agenda with so many legislators and advocates here with us, which is a testament to how important affordable, equitable, and universal health care for all Californians is, and that we need it as soon as possible. We appreciate all of our legislative champions joining us today, including Assemblymember Dr. Aila Weber, Assemblymember Dr. Joaquin Arambula, Assemblymember Tasha Burner, Assemblymember Wendy Kio, Assemblymember Rick Chavis, Zabur, and Senator Katherine Blakespear. And we thank our partners in attendance. Oh, and Dr. sorry about that. And Dr. Wood. And Laura Freedman. Thank you to our partners in attendance and the Latino Coalition for Healthy California, California Pan-Ethnic Health Network, Western Center on Law and Poverty, Children Now, SEIU California, the Leukemia and Lymphoma Society, Equality California, and more. I want to kick us off today by introducing Anthony Wright, Executive Director of Health Access California, the convener of the Care for All Coalition.
All right, good morning. Again, my name is Anthony Wright. I'm the Executive Director of Health Access California. Thank you, Angela, and for everybody for being with us today. In the last 14 years, under our state's efforts to implement and improve the Affordable Care Act, California has led the nation with the biggest drop of the uninsured rate of all 50 states. The Care for All California campaign began in 2018, when after successfully fighting against the repeal of the Affordable Care Act, we sought to take further steps toward a more universal, affordable, quality, and equitable health system. Complementary with other longer-term efforts for broader structural reform, the focus of this campaign is to get real relief to Californians urgently and to push us to take action on what we can now. These actions Californians can take immediately without constitutional changes or federal approvals. And in 5 years, working with state policymakers, including some of the champions standing up here today, the coalition has helped advance over 30 bills and budget items, making remarkable gains in California, instituting first-in-the-nation state subsidies to help more low and moderate income people afford health plans, expanding health coverage to more Californians, regardless of age or immigration status, fighting the skyrocketing cost of coverage and care and prescription drugs, and more. This year, our bill package has a baker's dozens, with nearly 20 organizational sponsors, and they're as diverse and impactful as ever, encompassing bills to continue to expand care and lower costs, but also ensure access and address health disparities. We are proud to continue our efforts to expand access toward health for all, to open up our state's exchange to all regardless of immigration status. We also want to ensure that those who are covered stay covered and that they have access, whether to mental health or other key services. The package also goes further than ever to address racism and discrimination in our health system, including to build on the past work to address health disparities, including in maternal mortality, and to advance the work of culturally competent community health workers. And a top focus of the campaign as well is to work to tackle the rising cost of care by ensuring the key benefits are covered, from medical equipment to preventive services, and that hospitals fairly price their services and protect patients in their billing practices. So a leader in the efforts to make our care more affordable is our now Assembly Speaker Pro Tem, Dr. Jim Wood. This year, along with Attorney General Bonta, he's continuing his crucial work to protect Californians from harmful health care consolidation, one of the primary drivers of high health care costs. To talk about his bill to put more oversight over takeovers by private equity, which often puts profits over patient care, I am pleased to welcome, again, Speaker Pro Tem, Dr. Jim Wood.
Thank you, Anthony, and good morning to everyone. Thanks for inviting me to be here this morning. I'm here to talk about AB 3219, a bill I'm working with the sponsor, the Attorney General, Rob Bonta. It will provide more oversight on private equity acquisitions and consolidations in healthcare. Since being elected to the legislature in 2014, I've dedicated much of my energy and efforts to ensuring that all Californians have access to quality, affordable health care. I believe I've attended every Care for All press conference held since 2018 and have had the honor of receiving your support on many, if not all, of the health care bills I've introduced. I'm proud of my accomplishments so far, but until we have more regulatory authority and oversight of private equity acquisitions, we may not be able to adequately protect patients. The majority of studies show that healthcare consolidations are not lowering costs for anyone except for the entities consolidating, including those acquired by private equity or hedge funds. We are often led to believe these consolidations will save money and that it's good for consumers. But what we're actually seeing in healthcare is just the opposite, and it reduces competition, which results in higher corporate and shareholder profits. After all, private equity investments are typically short-term, with the goal of generating a profit for investors, not a priority of improving healthcare or lowering costs. AB 3129 authorizes the Attorney General to grant, deny, or impose conditions to a change of control or acquisition between a private equity group or a hedge fund and a healthcare facility or provider group. That's a mouthful, I know. It's pretty simple, though. It also protects healthcare providers by reinforcing the ban on the corporate practice of medicine, providing a fundamental protection from interference in how providers practice. Although opponents have tried to argue that consolidation helps integrate care and control costs, it appears it's only their studies that show that, not the many independent studies that show these types of transactions in healthcare in fact result in higher healthcare costs and profits for the corporations and investors rather than lower costs for patients and healthcare for consumers. I look forward to your support, and I thank you very much for the opportunity to be here this morning.
Thank you. Thank you, Assemblymember Wood. Here to discuss her bill to protect Californians from high medical costs, AB 2297, is Assemblymember Laura Freedman.
Good morning, everybody. I'm really honored to be able to be here standing shoulder to shoulder with a really incredible group of policymakers and very dedicated advocates who've been working tirelessly in the push for more affordable and equitable health care in California. I'm proud of what California's accomplished over the years to protect patients, to strengthen consumer rights, and to improve access to quality care in every community. But as you've heard, there's more work to be done. The fact that we still have constituents who come to us with medical bankruptcies is really an abomination in a state as wealthy as California. So we have so much more work to do. I'm here today as the proud author of AB 2297, which strengthens the protections for patients under the Hospital Fair Pricing Act and builds on the work we did a few years ago with my AB 1020. Medical debt is a significant driver of bankruptcy, poverty, and racial inequities. It also impacts access to care. In a nationwide survey, nearly 1/4 of adults reported having medical debt that they could not afford to pay off. Of those with medical debt, 8 out of 10 reported skipping or delaying medical care or medications due to the cost. 1 in 7 reported being denied medical care because of their outstanding debt. How could we allow that to happen right here in California? Now, here at home, a third of Californians report having medical debt. A third of Californians. Let that sink in. 53% of Californians say they skipped or postponed health care in the past year simply because of the cost. Among those who skipped or postponed care, 46% said it made their conditions worse. So we're ending up with a patient population coming in sicker, which in the end ends up being, of course, more expensive to treat. So it doesn't make any financial sense. Medical debt can also impact an individual's housing and retirement security when hospitals and debt collectors are allowed to place liens on their properties. Unfortunately, the protections that we put in place fall far short of protecting low and moderate income patients who own homes. For many Californians, their homes are their greatest asset and often the main way that families build generational wealth. However, a loophole allows debt collectors to place liens on patients' homes to collect unpaid medical debt. AB 2297 closes that loophole and prohibits liens on property when collecting medical debt from financially qualified patients. The bill also prohibits arbitrary deadlines for patients to apply for financial assistance and charity care to help ensure that patients have access to available assistance. Getting the care that you need shouldn't put you and your family at financial risk. I want to thank the Western Center on Law and Poverty, Bethsedec Legal Services, and all of the advocates standing up here today for their work on AB 2297 and healthcare affordability. Thank you.
Thank you so much, Assemblymember Freedman. I want to now introduce a key partner for the Care for All Coalition efforts to create a more equitable healthcare system, Ron Coleman Baya from the California Pan-Ethnic Health Network.
Good morning, everybody. My name is Ronald Coleman Baya, Managing Director of Policy at the California Pan-Ethnic Health Network. We work to advance health equity through policy advocacy by working with communities. As a steering committee member of the Care for All Coalition, we have worked to center health equity in universal health care and developing a universal health care system. Over the many years of this campaign, we have worked to do this through bills. But we have also worked to change the way we talk about care, how we think about who it serves, and how we think about who it doesn't. This year, we have important legislation in the package to address racial health disparities, such as curbing the impacts of discrimination in the Equity in Healthcare Act, authored by the chair of the Assembly Health Committee, Assemblymember Mia Bonta. Another key piece is a budget ask that will increase Medi-Cal reimbursement rates for community health workers, promotoras, and representatives who provide crucial services in underserved, low-income communities of color, and through their lived experiences, lend their expertise, services, and treatments to community members to make sure they can thrive. To address a disparity that can be deadly, I also want to introduce Assemblymember Weber to discuss her bill, co-authored by Assemblymember Wilson, to reduce the Black maternal mortality through implicit bias training. I welcome Assemblymember Dr. Aila Weber. Thank you.
Well, good morning, everyone, and thank you so much for inviting me to speak here today at this very, very powerful press conference. As stated, I am Assemblymember Dr. Aila Weber. I represent the 79th Assembly District, which covers the cities of La Mesa, Lemon Grove, parts of El Cajon, parts of San Diego County, and the unincorporated areas of Spring Valley. I stand here today as a proud joint author on AB 2319, which strengthens and clarifies the intent of the California Dignity in Pregnancy and Childbirth Act, passed in 2019. Now, that bill required hospitals, alternative birth centers, and primary care clinics to conduct evidence-based implicit bias training for all health care professionals who provide care during a patient's pregnancy, childbirth, and immediate postpartum period. We all know that, unfortunately, implicit bias exists, and that people may treat individuals more or less favorably than others based on their age, race, gender, religion, or other characteristics. And unfortunately, our maternal morbidity and mortality rates here in California prove that maternal care is inequitable. People of color, particularly Black women, continue to die at a rate 3 or 4 times more than that of white women. Last October, the Department of Justice released a report outlining the level of compliance in the 2019 Act at different facilities. The results of this report were extremely disappointing. Only 17% of the facilities had completed training for all staff, and a substantial number of the facilities had not completed or even begun the training for their staff, even after receiving the DOJ's August 2021 letter, despite the effective date when they were supposed to start on January 1st, 2020. We heard that the facilities need better guidance on how to properly comply with the Act requirements, and this is where AB 2319 steps in. It will provide the clarity on which facilities are mandated to administer anti-bias trainings and which employees need to be trained. It provides enforcement powers for the Department of Public Health and the Attorney General. And it establishes firm deadlines by which the trainings must be completed and establishes administrative penalties for noncompliance. And finally, it authorizes a CDPH to issue guidance on model trainings to ensure these trainings are actually effective at reducing implicit bias. All women, regardless of race and socioeconomic status, deserve to have a healthy pregnancy, a healthy birthing, and delivery experience. And as an OBGYN, this bill is extremely important to me. Because right now we know that implicit bias perceptions cause delayed diagnosis, missed opportunities to catch each warning sign. We hear stories and see the patients where their complaints of pain and stress have not been taken seriously and ignored, especially for women of color. And the outcomes have been deadly. AB 2319 is one step forward in ensuring that implicit bias does not stand in the way of compassionate and competent health care that we all deserve when bringing in a new life into this world. Thank you.
Thank you, Assemblymember Weber. I want to now bring up another Essential Care for All coalition partner to discuss the efforts to expand health coverage, access, and benefits for more Californians. I welcome Sandra Pool for the Western Center on Law and Poverty.
Thank you, Angela, and good morning, all. Again, I'm Sandra Pool from Western Center on Law and Poverty. As mentioned earlier, this coalition was convened in 2018 to identify steps that we could take as a state to make our health system more robust, while at the same time, at the federal level, they were looking at cuts to benefits and services. Since then, this campaign has been able to push legislation to get California to the lowest uninsured rate ever. We must protect our gains while we push for more. This year's package of bills will do just that, from expanding care to more regardless of immigration status, to ensuring health care standards are met to prevent barriers to access. We are also asking to ensure continuous coverage in Medi-Cal for children up until age 5, with a budget ask to implement that plan this year. Our youngest children should not be on the brink of losing coverage every year at a time when it is most crucial to have regular checkups and access to pediatricians. We have a number of legislators with us today to discuss their bills that will strengthen our health system by covering more people and protecting access to those that are covered. To talk more about a bill that will expand the work of the already successful Health for All campaign to cover all Californians regardless of immigration status, I welcome Assembly Member Dr. Joaquin Arambula.
Buenos días y gracias por esta oportunidad para venir y hablar con ustedes el día de hoy. Soy importante que en el gran estado de California que todos tienen la oportunidad para el cuidado de salud. Yo quiero dar mis gracias al Western Center on Law and Poverty, on Health Access, on CPEN, and all the others who have helped to make our People Power movement so successful. Since 2015-16, we've worked to enroll over 1 million Californians into Medi-Cal. And our work needs to continue to make sure that we work on the affordability for our undocumented community for those who are earning just over 138% of the federal poverty level. For those of you who might not know it, that's about $20,000 for an individual. That's barely enough money to keep food on the table and a roof over your head, and not enough to make sure that they have access to health care. And so I look forward to collaborating with those who are behind us to continue this movement of expanding healthcare access to all who call our state home who are income eligible. It has been a tremendous honor to work on this movement and to realize the accomplishments that we can do together when we fight and be the change that we want to see in this world. California has a legacy of leading. I'm proud of the work that we've done together, and I look forward to the battles ahead.
Thank you, Assemblymember Arambula, and thank you for reminding me I'm a no Sabo kid. I want to introduce our next speaker to discuss her bill that will help people keep their Medi-Cal coverage, Assemblymember Tasha Burner.
Good morning, everyone. I think we should count ourselves very lucky. We have 3 doctors here and 3 San Diego County legislators. So we're all in the House today. And I represent District 77, which is coastal San Diego. Hundreds of thousands of Californians are experiencing gaps in their health care due to Medi-Cal's current re-enrollment process, and this is unacceptable. According to the California Department of Health Care Services, 200,000 Californians were dropped from Medi-Cal in September 2023 for lacking the necessary paperwork, despite being still eligible for coverage. These are our families, these are our children, who cannot go to the doctor for checkups and health care services simply for a typo on their application or lacking one piece of paper. I introduced Assembly Bill 2956 to ensure individuals enrolled in Medi-Cal can keep their coverage for an additional 12 months as they gather the materials they need to continue their coverage. I want to thank the sponsors of AB 2956, Western Center of Law and Poverty, the Children's Partnership, and the Latino Coalition for a Healthy California for working with my office to ensure that our most vulnerable communities in California no longer experience a lapse in health coverage because of administrative red tape. Thank you.
Thank you, Assemblymember Burner. Next, I'd like to invite Senator Katherine Blakespear up to talk about her bill to protect patients with pre-existing conditions.
Thank you and good morning. My name is Senator Katherine Blakespear, and I'm grateful for being invited to speak today about my bill. I want to thank Care for All California for putting together this event, and Health Access and all the other organizations involved. I'm the state senator representing northern San Diego County and southern parts of Orange County. We have so many great bills here today and speakers advancing health care for all Californians. And I'm here today to tell you about another bill, SB 1236, which is legislation sponsored by the Leukemia and Lymphoma Society that I have authored. We fought for years with the Affordable Care Act to protect people with pre-existing conditions from being denied health coverage, but some people are still falling through the cracks. SB 1236 ensures that people seeking Medicare supplemental insurance, known as Medigap, are protected from being penalized for having pre-existing medical conditions the same way that all Americans are protected in the regular private health insurance market. Medigap, which requires a monthly payment, is insurance that seniors often use in addition to traditional Medicare to cover high-maintenance medical conditions. Current federal law prohibits private insurers that offer Medigap insurance policies from penalizing seniors for their pre-existing health conditions under a narrow set of circumstances. But outside of these circumstances, the provision does not apply, and seniors can be charged exorbitant rates for coverage or can be denied coverage altogether. Seniors should have access to affordable health care coverage regardless of their health status. SB 1236 makes sure that's the case. Last fall, one of the 3 major health systems in San Diego County announced that it would not renew its contract with Medicare Advantage plans due to the plan's administrative issues and low reimbursement rates. Thousands of patients had to switch providers or change their insurance plans, and many found that switching to Medigap would be unaffordable for them due to their pre-existing medical conditions, and this left them with few options. Many of us don't think that's right or fair, and that's why I have authored this bill. Under SB 1236, patients could switch to a Medigap plan and still see their providers without an unexpected increase in health costs. This is an important protection that seniors deserve to have. Thank you again to Care for All California Coalition for including SB 1236 this year in your priority bills. Thank you.
Thank you, Senator Blakespear. Now I'd like to invite Assemblymember Carrillo up to discuss an important issue to protect timely access for mental health services for our youth.
Thank you, and good morning, Angela. Proudly representing our district constituent, VIP. My name is Wendy Kio. I proudly represent the communities of Northeast Los Angeles, East LA, and half of the city of Glendale in Assembly District 52. And I'm so grateful for Care for All California for including our policy on mental health access in this year's priority legislation, as well as a big thank you to the Children's Partnership and Health Access California and all of the members of the association who are supporting all the good work being done related to access to mental health. Last year, I stood with all of you in urging Governor Newsom to sign Assembly Bill 665. And I just want to point that out, how important that policy was. And I was just in a meeting with the National Urban League, who I've invited to this press conference, on the importance of mental health for low-income communities of color. The mental health access consent parity for Medi-Cal recipients to expand access to mental health for young people on Medi-Cal was an issue related to mental health justice. More than 10 years ago, the state of California passed a law that allowed adolescents 12 and older to receive mental health care and mental health therapy, but only if they had private insurance. That means that for 10 plus years, young adults on Medi-Cal did not have the same and equal treatment and access to receive mental health therapy. We changed that. And that is now a law moving forward in the state of California. And today, I seek what I would consider the next step in that access, and that is backing of AB 2466 on mental health, a pivotal step forward in our efforts to tackling mental health access challenges and improve the services we already provide across the state. But I ask you, what value do these services hold if the very communities that need them can't access them? A recent audit by the California Department of Healthcare Services and the Department of Managed Healthcare found that children covered by Medi-Cal encounter difficulties in obtaining behavioral health services in a timely manner, despite state laws that are now mandating healthcare plans to maintain an adequate provider network to ensure timely appointment scheduling. We're falling short in meeting these essential needs. DHCS has an estimated of 80% threshold for ensuring that health plans provide timely access to Medi-Cal appointments for their enrollees, which is applicable to primary care providers and specialists, but currently holds no threshold for therapists. With the introduction of AB 2466, we stand on the brink of a transformative shift in our healthcare landscape, especially for children and adults who rely on Medi-Cal, which is a large percentage of the state of California. The bill represents an opportunity for improving access to services that we also desperately need in our communities. First, by mandating that our Medi-Cal managed care plans truly put their best foot forward in recruiting new providers, especially in scenarios where there's a glaring shortage. It's not just about filling the gaps, but ensuring that those gaps don't compromise the quality of care that communities receive. Secondly, requiring a crystal clear definition on what timely access truly means. Everyone is deserving to know exactly when and how quickly they can receive the Medi-Cal care that they so desperately need. And let's not overlook the importance of accurate provider directories, clearly listing providers who are practicing or responsive, ensuring every name listed on a provider list is ready and able to serve. How many times have members in our community called a list of Medi-Cal providers only to find out that the clinic is no longer there, the therapist is no longer practicing, that phone number no longer works. And when you are spiraling, and when you have a young person that needs immediate attention and the numbers don't work, it creates a scenario of feeling completely alone and isolated across communities. The number one issue that young adults are facing across California and across the country is suicide. We have an opportunity to change the direction of mental health care in California, not only with passing laws to access, but ensuring that the providers are available to actually create that access. I'm really excited to move this forward. It is a clear message that we are moving in the direction of access, not just on paper, but on reality. So I want to thank Care for All California for including our policy, and I look forward to moving this bill through the legislature and ensuring that it gets to the governor's desk and has a signature. Thank you very much.
Thank you, Assemblymember Carrillo. Glad to be a proud constituent. And finally, our last legislative speaker, we welcome Assemblymember Zeber, whose bill to ensure health plans cover vital preventive services with no out-of-pocket costs makes care more accessible and lowers costs.
Good morning, everyone. My name is Rick Chavis Zeber, and I represent the 51st District, and I'm really grateful to be with you today. I'm here in particular to speak about AB 2258, which is sponsored by Insurance Commissioner Ricardo Lada, Equality California, APLA Health, the Los Angeles LGBT Center, and the San Francisco AIDS Foundation. Protecting access to affordable preventive care is critical to identifying and addressing health challenges before they become serious, particularly for marginalized populations. A study found that a $10 cost for HIV prevention medication doubled the prescription abandonment rates, increasing the potential of HIV infections across patients across California. Barriers to preventive care force people to choose between preventing expensive and devastating health problems and putting food on the table. While we do have protections for preventive care in California, some of them are based on federal protections, and there's concern that recent court cases may put the federal preventive services requirements on which this state relies in peril. Among other things, AB 2258 will codify in California law existing federal guidance requiring health plans and health insurers to cover services that are integral to the delivery of recommended preventive services without out-of-pocket cost, including reversible contraceptives, PrEP, and HIV and other STI screenings. In essence, this bill is about ensuring that low-income people have the same access to the same comprehensive and affordable preventive health care as everyone else. My bill on this topic was unfortunately vetoed in 2023, having been misconstrued as unnecessarily costly. However, we know that it's critically important to preserve high-value preventive services and screenings that this bill protects, which analysts have found to have clear and convincing evidence of medical effectiveness because it saves so much in both cost and lives in the long run. So while we may have some short-term small increases in costs, in the long run, it both saves costs and protects lives. I want to thank you for standing with me, and I want to thank the organizers of the conference today for having me. Thank you.
Thank you so much, Assemblymember. We are thrilled to be able to present this package around healthcare access. We thank you all again for joining us here today, and for those of you watching on the live stream, you can find all these bills on our website at www.careforallca.org. I will now open it up to questions from the audience.
Yeah, I'll go. A couple, actually. First, Dr. Wood, like you said, you have worked on issues of consolidation for years, including trying to get some more teeth into the Office of Healthcare Affordability.
No pun intended there.
No pun intended, of course. So what is different about this approach? What makes you think you're going to be more successful this year over other attempts?
Well, I believe we'll be successful. This is a very targeted approach, specifically at private equity and hedge fund acquisitions. These are accelerating at an alarming rate throughout the United States, particularly within the skilled nursing facility world. A lot of acquisitions that are happening. It's been flying kind of under the radar, and my concern is that these entities exist for one reason and one reason only, and that is to make profits. And my vision of healthcare, it is about taking care of patients. And so they put profit first, I'm putting patients first. I'm not against the concept of consolidation if it truly benefits consumers. This is an opportunity to give the Attorney General the opportunity to look at these transactions and see, are they actually going to benefit patients, or are they going to benefit the investors? So, thank you.
Okay, also, I'm going to ask one more. This bill on, School Members Burr, is this, just kind of a technical question, is this a response to the Braidwood case? And like, will that cover the things that the Supreme Court is currently looking at?
This would actually codify into state law the protections that are actually at risk in the federal courts. So, thank you.
Okay, and then one more. Everybody can't. So, Dr. Arambula, AB4, can you kind of give us a little bit of an update there? Is that in the budget this year? And where are we on sort of finding money for subsidies? Obviously, buying full-free health insurance is incredibly expensive and might still be inaccessible to the people you're opening the market to. So where are we there, and sort of what's next?
I'll start with process if I can. Last year, we initially attempted a 1332 federal waiver similar to the state of Washington, and I've made a pivot to follow the state of Colorado, looking to create a mirrored exchange similar to what they did with Omni Salud. The importance for this year is to make sure that we get it implemented and operational, that we uplift the system and create that mirrored exchange. We'll work on the questions regarding subsidies in following years and expect those discussions to continue. But for now, we're focused on making sure that we have a system that's ready to receive people as soon as we're able to find the resources for those subsidies.
I will, Anthony Wright, at Health Access, which is also the co-chair of the Health for All campaign. I would also mention we recognize that affordability is a real barrier. That's why we've been doing so much work, whether it's on the bills like on private equity or on health, hospital costs, et cetera. But first and foremost is just a barrier of just an explicit barrier that you can't use Covered California regardless, and that is not keeping with California's values of inclusion. And we do think there's a practical benefit as well. 70% of undocumented immigrants are in mixed status families. So you could very well have the child who is covered and subsidized, one of the family members, one of the adults, but then the other adult is excluded and it has to go outside of the exchange to find their coverage. And especially for a family that wants to be covered by the same plan, by the same provider with the same benefits and cost sharing, that could be crazy making to sort of figure that out on their own. To have a common place where you can get signed up, even if maybe one or two members are getting the benefit of subsidies, but at a third, they stretch to get that family member covered because they recognize the value of it and they can try to make it work within their family. I'm not going to say that that's a majority of the people who are benefiting, but even if that's a small percentage, in the state of California, that's literally thousands of people who would be benefited from this piece of access. And to your earlier question about preventive services, the Braidwood decision is something, it is a direct attack on the coverage of certain services for reproductive rights and LGBTQ populations, but the court case threatens to undo literally the most popular provision of the Affordable Care Act for all of us in terms of coverage without cost sharing for preventive services. And so it's a classic example of attack on one is attack on all. And we have an obligation in California to protect both the specific people who are being attacked, but everybody, and this is a step to do that, as we've done in a lot of other areas over the last several years in our work to implement and improve the Affordable Care Act. So those are, just two additional things backing up my champions. Other questions?
All right, can we get a round of applause for our health champions? Great, thank you. Have a good rest of your day. Great job.